Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, welcome back Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Dealing with Physician Negative Feedback. Jessie, welcome back to the show.
Thanks so much.
All right. So tell us what your latest article is about.
So, this article is about the reaction that we have as physicians to negative feedback, which is usually quite a reaction. The criticism, and I would say any kind of criticism, feels huge and significant and stings a lot, and it often lasts for a long time. And I do a lot of coaching around people having feedback. Maybe it's a patient complaint, maybe it's a feedback from a leader. And we tend to just dive into rumination and self-doubt and impacting things like sleep. Sometimes people even take it to like their ultimate career choice. Was it a mistake? Are they a decent doctor? And we can take these tiny bits of feedback and just blow them into things. And so I thought the conversation around what can we do and how can we respond in a way that is less costly and more helpful to us is worth a conversation.
All right. So, what is the typical physiological response that physicians get to negative feedback? And I think that this could apply to anybody. Nobody likes
Yes.
negative feedback, right?
Nobody does, and we dislike it more than the average person because we're trained to think that if somebody doesn't like us, something terrible will happen. It means something bad. And that comes back from the root of our training, right? If you weren't liked on rounds somewhere, then you wouldn't get the next residency, the next fellowship. And in my day and age, you'd end up under a freeway overpass homeless because you couldn't pay back your loans, or like that was the energy that came to it. So we see feedback as a threat, and our nervous system goes into fight or flight or freeze. And the freeze is a bit of the rumination. And so it's very common for people when they get some kind of negative feedback to lose nights of sleep over
Hmm.
it, to not be able to get out of the spin, and to then start to weave stories that are quite painful and much bigger than the initial comment. And sometimes they're not even meant to be critical comments. Sometimes they are, but our brain weaves these elaborate stories about them from the lens of trying to protect ourselves from harm, and yet we are causing ourselves harm in in our reaction itself. And I think that, it's trained into us, and so it's very hard to untrain it. We also, somewhere along the line, have been taught to equate responding and taking it seriously as part of being a good doctor. Like if someone were to send a patient feedback, for example, well, number one, we often have to respond to it. But
Hmm.
number two, it's like we have to take it very seriously, learn from it, change things, et cetera, et cetera. And yet, very often, patients aren't actually, all of our patients are not supposed to like us, despite what Press Ganey and other versions of getting patient scores are. And, I think that good doctors actually do get complaints because in peds, we don't always prescribe antibiotics
Yeah.
and we shouldn't always be prescribing pain meds and we shouldn't always be doing all the things that patients want because they're actually not trained in medicine. So good medicine actually has disappointed patients, but most of us are so uncomfortable
Yeah.
disappointing anyone. We equate it with danger.
Yeah. So I think that I see this sometimes in the context of medical malpractice trials, right? Where
Yes.
physicians who are on trial for a perceived mistake, they take it so personally, but then you have the attorneys, the defense and the plaintiff attorneys, they argue so viciously in the courtroom and then,
Yes.
after the case, they go out for dinner together, right? And
Yes.
it's part of the job, but the physicians left there taking things so personally.
Oh my gosh, yes. And my husband's actually an attorney, and one of the things that I've learned about law is that being a attorney is about telling good stories, and it's really about who can tell the better story. And yet we take it as facts and judgments about our care, our ability, and even how much we care.
Hmm. And you wrote in your article that sometimes negative feedback even hurts the most seasoned physician. It doesn't matter how long you've been in medicine, whether you're a trainee or whether you've been practicing medicine for 30, 40 years, negative feedback still hurts the physician.
Yeah, I don't think it has anything to do with how long you're practicing. We're actually, I believe, trained to think that any negative feedback is not okay. I often told people when I was a department chief that when we do our evaluations, we actually had a box we had to put things that people could improve. And that box, if you watch, it would trigger people's nervous systems, but you couldn't close the evaluation if you didn't put something there. And so I think that for me, it was always a challenge because I knew that anything you put there would be triggering. And I don't think it's that physicians don't want to improve. I think we actually do want to improve. And that's why understanding this nervous system response and figuring out how we can respond in a way where we can actually feel curious and calm and grounded and learn rather than go into the shame, blame, catastrophizing, overwhelm is actually useful, but it takes a lot of work.
All right. So let's talk about some of that work. So
Yeah.
how can we train physicians to accept negative feedback more
Yeah.
in a more helpful,
Well,
more healthy way?
it's interesting because I think the first thing I was going to say was work on your physiology, but I think the first thing is actually to notice how we personalize and notice the thought patterns of catastrophizing and all of those things. And if you can notice them before you notice your physiology, perfect. Sometimes our physiology is freaked out in such that we can't notice anything, right? We're just in this spin of, I think, just recognizing the fight, flight, or freeze
Hmm.
and taking a moment to regulate your nervous system to the best of your ability. So that could, for some of us, is just taking a few deep breaths.
Yep.
Sometimes it's the hand to heart shifting those neurochemicals so you're not in a cortisol, norepinephrine bath. And we know this in healthcare, but we don't take the time to do it. So taking that pause, figuring out what you can do to settle. And I think in the case of negative feedback, acknowledging that it's really challenging. And so you'll go in and out of these moments of regulation. And so sometimes we need an even longer pause, especially if it's something like a malpractice, which we take as negative feedback. Like that can take a month of pause. But in these smaller instances, taking time to work on your nervous system. And I think working on it outside of negative feedback so you have access to what that feels like,
Hmm.
figuring out tools that you can have that help you ground and just get out of the literally physiologic and brain spin. And so that's a lot of the mindfulness tools, and there's so many, and finding one that works for you. I think we have to be exceptional at meditating, and I don't, a lot of physicians are not, and that's
Hmm.
okay. But like, can you just look at taking some intentional deep breaths? Or for some, it's one pose, like maybe it's doing a child's pose and putting your head on the ground, or even putting your head on a desk or a yoga block to just shut your mind off from that spin. You're essentially trying to interrupt the automatic physiologic response. And then you can get to the like, what is true about this? Because there is always something true about it. And I also like to say what is true is that people will always complain.
Hmm.
And what is true is that you will always be upset when someone complains because we're all trying to do something good. And so I think acknowledging those two things right up front, like people will complain and that you will always be upset when someone complains. Nothing's gone wrong when either of those two things happen. Then you can get on to other things like telling a neutral story, or I call it a generous story, which means a story that doesn't make it worse, a story that doesn't flip you into more physiologic cortisol, sympathomimetic storm, and a story that's also true. I think that, patients have their own stories. They're coming from their own space of scarcity, or, a patient in pain, of course, wants some medication that's going to work, even though they don't understand the long-term
Hmm.
consequences of it. So telling a story that maybe you acted from a place of integrity, you acted from a place of good care, and not all patients would understand that. That's what I mean by generous story, not a made-up story that nothing bad will come of it or that you shouldn't be upset about it, because that's really being mean to yourself. Of course you're upset about it. And then I also really like this strategy of like asking better questions. Well, what can I learn from this? What else could be true as your brain is offering scary
Hmm.
stories? Another one I love is like, what if we were a mismatch? Like a mismatch, in pediatrics, you're not a match for every
Yep.
family.
Yep.
Surgeons are not a match. Like
Yeah.
your style might not be a match. So asking questions that sort of get you out of that, or how does this shed light on your strengths? Like maybe you actually practice very judicious antibiotic or pain medicine approaches, and not all patients will like that, right? The other piece that I think is so helpful is focusing on what's in your control, which is not what they wrote. It's how you respond to it or what you write in response and how you choose to take care of yourself. And I think sometimes when people have gotten better at responding to negative feedback, one of the things they do is get mad at themselves for not handling it as well. I have done this a lot,
Mhm.
where I'm like, well, I know all these things. How come I'm still upset? And so just recognizing that we're human and all humans get upset and we can get better and better at it, but no human loves negative feedback. They're just not going to. So I think just recognizing that it's going to be painful and
Mhm.
work and that it's a process and that we'll just get better and better. But I think so many people just get in that spin and just struggle, struggle, struggle to get out.
Yeah. So a lot of things that you just mentioned requires things that aren't done impulsively. So again, we talk about
Yeah.
the pause. We talk about not acting in the immediate aftermath of receiving that feedback because all the things that you just mentioned require some reflection and not responding when you're emotionally dysregulated, right?
Yes. Yeah, and I'm thinking actually,
Mm.
we talked a bit ago about, physicians who get called out or get in trouble. And I think that comes usually when there's negative feedback and we respond in dysregulation. And so recognizing that the long term of having less negative feedback is actually learning to regulate in responding to it. I think also just that a lot of this comes from caring. We
Hmm.
care and we want to do a good job and we want to make a difference. And so when we do get negative feedback, it gets at something that feels so integral to who we are and why we do medicine that it feels like extra pain and this extra judgment. And I think the other thing that comes to mind here is what we make it mean. I think this is where people can really spiral into negative thoughts about themselves, self-harm, thinking they need to leave the practice of medicine, and a lot of shame around negative feedback. And could we, as a medical culture, normalize that
Yeah.
there's always going to be negative feedback? Much of the negative feedback today comes from systemic issues and not us, but there's no other way to address them than sending in a complaint or a patient complaint that might not even be about you. And this isn't to dismiss it because there's always something we could do better, but that's true of the human condition. It's just that we are perfectionists, so we don't like that human condition. I've had surgeons say, like, I don't want to be human. Humans make mistakes and humans get complaints, and it feels so threatening to us. So I think just recognizing how we feel threat physiologically and in our brains, and is it true that we are in danger?
And specifically in the context of patient satisfaction, like you alluded to, you don't necessarily want to be that physician who receives universal acclaim, right? You don't want to be the physician who acquiesces to every patient request, like antibiotics or opioids, for instance. So
Yes.
sometimes, in order to be a good physician, you have to expect negative
Yeah.
feedback and
Yeah.
maybe reframing it and having that expectation that negative feedback is going to come your way means that
Yeah.
sometimes you're doing a good job.
I think it can be a sign of doing a good job. It's bringing me back to the time when I was a department chief, though, and we were expected to reward physicians who had the best scores. But like someone who had 100% scores, that means that they're quite accommodating
Yeah.
and people pleasing usually. And so maybe we should actually be rewarding scores that are 90% or recognizing that some percentage of people are going to be dissatisfied. And isn't it interesting that our culture in medicine is like the perfect score is the way that we want to show up? And so I think recognizing when you have this feedback, did you act in integrity? Did you do the best that you could? Did you practice the medicine that you believe is the best care in the moment? And that's another example of looping back to asking good questions. Like when we ask good questions, then we can get out of this spin of
Mhm.
shame, blame, and guilt.
We're talking to Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Dealing with Physician Negative Feedback. Jessie, as always, let's end with some take home messages they want to leave with the Kevin MD audience.
One is to recognize that it's often not about you. It's got to do with the person who's complaining's nervous system, what's going on with them, and really naming your response because we say name it to tame it. So notice what's happening. And then I think it's absolutely worth creating and building a toolbox of ways to respond to negative feedback because that's part of being a human and to notice your defaults and begin to work on these things because we can change it. And if we are to survive in the healthcare system as it is, and even in any future healthcare system, there will always be patients who aren't pleased, and someone always has room for improvement. And if we can take it as what can I learn from this and how can I grow, and that it isn't personal affront or a threat or an assessment of your level of ability or your fit in a career of medicine, that's where we'll be able to move through it in a way that's healthier and more sustainable.
Jesse, as always, thank you so much for your insight. Thanks again for coming back on the show.
My pleasure. Thanks for having me.